All righty, we are going to get started. First, I want to thank all of the presenters, speakers, folks that are moderating panels for the next day. I want to extend my greatest gratitude. Your expertise and the perspective that you will bring into the summit is what will be able to guide our work for the next 5 years. And the Puerto Rican Agenda is always grateful for individuals who are always a part of the greater plan. My name is Jessie Fuentes, and I am the co-chair of the Puerto Rican Agenda. Good morning, and thank you all for joining us. I also see press on the line and folks that are watching us through any streamed lines. The Puerto Rican Agenda of Chicago is a nonprofit organization comprised of local Puerto Rican leaders ensuring the self-determination of Puerto Ricans in Chicago, throughout the diaspora, and in Puerto Rico through policy and advocacy. Many of you all being movers and shakers in the work, I am certain that we will come out of this summit with policy recommendations and an advocacy plan that will help us close the health disparities amongst Puerto Ricans and Latinx communities in this country. Today, we launched the beginning of the Puerto Rican Agenda's Health Summit. And before you all dive deep into the work, I want to set the context and provide the lens I would like all guests, presenters, and speakers to carry for the 2 days of our summit. The lens of structural racism and colonialism within the Puerto Rican context. We must understand the connection between the prevalence of chronic diseases among communities of color and their unnatural causes rooted in the practice of racism and colonialism. In 2004, there was a health study published known as the Improving Community Health Survey, led by one of our very own at the time, Dr. Steve Whitman. This study uncovered alarming health disparities, particularly for the Puerto Rican community. Puerto Ricans are the leading population that suffers from HIV/AIDS, diabetes, hypertension, asthma, obesity, and PTSD. Now, this study has more alarming data points that speak to the Puerto Rican mortality rate, specifically in the city of Chicago. And I'm sure that there are many experts today who will be sharing data points that allude to the same. Unfortunately, many will attribute these health disparities to individual behavior and culture. I beg everyone to dismiss that lens and instead seek to understand the unnatural causes behind the crises in Puerto Rican health and illness. It is and will be our moral obligation to understand the public health crisis in our community within the framework of systemic social forces, which have created poor living conditions for all communities of color in this country. It is inequality, poverty, and systemic violence that determines who falls ill and who receives quality care in this country. We must understand chronic diseases within our people's historical lived experiences. It would not be enough for health experts or community organizers to say that if we change individual behavior, we can combat chronic diseases by changing them. We must engage in a process of decolonization, and that starts with addressing the systemic issues at hand. We must provide a fair and just opportunity for Puerto Rican and Latinx folks to be self-determined, self-actualized, and self-reliant. And that means that we must move forward a policy agenda that can provide those opportunities to our communities. I am hopeful for what this summit can bring, and I am extremely grateful for my colleague who has taken this summit on, and I want to be able to pass it on to the co-chair of our health committee in the Puerto Rican Agenda, Dr. Aida Giachello. Thank you.
Buenos días. Good morning. I'm so excited to see so many of you. We had over close to 300 registration, and still this morning, people are registering to the activity of the next 2 days. Most of them will be with us, even taking time off based on what they have told me to be with us today because of the interesting program that we have. I want to thank Jessica for her leadership. She didn't really introduce herself, but she has been a strong advocate in the Humboldt Park Latino community and then nationwide. You see her, she's very humble, but she's a tremendous fearless leader. And so we're so happy that she's providing the leadership of the Puerto Rican agenda. The Puerto Rican agenda, I just want to add that we don't have any staff. Everything that we do is volunteer. So including practically most of the planning of this event, we were very fortunate to have a group of corporation that came forward, community-based organization that in a very short period of time allowed us to have some basic, very little money to be able to take care of all the logistic of establishing a website and all the logistic of make sure that everything else related to this activity in terms of production would be done, consulting with expert in the field to make sure that we have the best program possible. So I want to take the opportunity to thank them for that. Now, very briefly, I wanted to introduce you our next speaker. She's going to be giving greeting remarks, and her name is Darlene Caskey. Darlene is someone that I have had the opportunity to work closely with her, particularly in the last 6 months. So I'm very, very, very much an admirer of her and her leadership. She is currently a community engagement coordinator of the Greater Midwest region that covers several states of the network of the National Library of Medicine at the University of Iowa. She's an expert in her own right. She's a librarian, and she really supports access, particularly to biomedical information. And she's been helping raise awareness of a very unique program that maybe many of you hopefully have heard, which is the All of Us program that is really trying to advance precision medicine. It's the new trend in medicine that is important for all of you to have that kind of awareness. So in partnership with a number of organizations, including the Puerto Rican Cultural Center, she is collaborating with us in a number of educational activities and outreach effort. And that's how I've had the opportunity to get to know her better and work with her on a weekly basis, sometime more often. And she's one of the major sponsors of this event. So I really want to welcome Darlene Caskey, my good friend, Darlene Caskey.
Thank you, Aida, Dr. Giello. Thank you so much. It's been a pleasure working with you on this project with the Puerto Rican Cultural Center. And I am with the network of the National Library of Medicine, and we're located, Greater Midwest region is located at the University of Iowa. So we're not too far from Chicago. So I've been very honored to work with Dr. Giello and the Puerto Rican Cultural Center to bring trusted, meaningful health information to you. If you're not familiar with the National Library of Medicine, I will tell you that it is one of the largest biomedical libraries in the world. And it offers a vast print collection as well as electronic resources to researchers, health professionals, and the general public. And the network of the National Library of Medicine consists of 8 regional academic health libraries, of which I'm at the University of Iowa, and over 9,000 partners who support our mission to share quality health information. We have a variety of materials to offer to the public and to raise awareness of an NIH All of Us research program, which is about precision medicine, because we know that one size of health doesn't fit everybody. And we need to respect and be aware of everybody's individual biology, environment, decisions they make, behavior choices. And then together with our partners, we are able to collaborate and fund events like today to support our community's health information needs that are relevant to you. So thank you again for letting me attend and be part of this great summit. And if you would like to learn more about our organization, please visit nnlm.gov/all-of-us. And I will be available tomorrow for one of the breakout sessions, and I hope to visit with more of you there. Thank you.
Thank you, Darlene. It's a pleasure again to have had the opportunity to work with you. And now we're going to be introducing Juan Calderon. Juan Calderon is the Chief Operating Officer for the Puerto Rican Cultural Center. And he's going to let you know that this is an organization that has been around for more than 60 years and has programs from culture-related matter to public health, including a recent clinic with the Helen Rodriguez Tria, one of our heroes in public health. And he's going to be addressing and giving you a little bit more information about that. So Juan, you have the floor.
Thank you, Dr. Giacello, and thank you all. I want to welcome all panelists and guests and students that are joining us today. My name is Juan Calderon. I am the Chief Operating Officer at the Puerto Rican Cultural Center. The Puerto Rican Cultural Center is named after Juan Antonio Correger, the celebrated Puerto Rican national poet and one of the most significant political theorists of the 20th century. The Puerto Rican Cultural Center educates, organizes, and struggles for the social, economic, and political empowerment of Puerto Ricans within a context that is historical in nature and organic in form. All of the PRCC programs encourage participants to think critically about the reality and to promote an ethics of self-reliance based on social responsibility. The programs that we have, such as Vida Sida, El Rescate, Consuelo Lee Correger, the Community as a Campus, the Generational Trauma Center, and many other programs, enhance diverse issues that include wellness, social, educational, cultural, and quality of life that matters for Puerto Ricans and Latinos and other marginalized communities. Our programs take on HIV, education, literacy, housing, homophobia, substance abuse, gang violence, teen pregnancy, police brutality, racism, economic and community development, and human rights violations, and the devastation of generational trauma for people that are colonial migrants. The Puerto Rican Culture Center and the work of the PRCC is informed by a social ecological model which recognizes the interplay among key factors, including social justice, community and institution building, community advocacy, environmental justice, education, housing, and access to equitable healthcare. And the last one is very important, especially as right now we are confronted within a pandemic. We hope that everyone here enjoys and learns about some of the struggles, some of the impact of what it is to be colonial migrants living in the mainland, which is the United States, or as we consider it, and to learn about what is taking place at the island nation of Puerto Rico among Puerto Ricans. So thank you all, and we hope that everyone enjoys a great summit today.
Juan, now it is for me a great pleasure to introduce someone that doesn't really need introduction. It is someone that is a leader in her own right, and an African-American, the first African-American lieutenant governor, which is Juliana Stratum. She has served prior to this position as the Illinois State 48 Lieutenant Governor since November, and she is right now passionate about health equity issues. She's involved. I have had the opportunity to work closely with her in her health equity committee that addresses COVID-19 and many other important issues that affect our community. So I don't know whether she is already with us, Lieutenant Governor.
I am here. Good morning.
You look beautiful as usual.
Thank you so much, and good morning, everyone. I am Juliana Stratton, and I use the pronouns she, her, hers. And I'm so glad to join you this morning. Thank you, Aida, for that warm introduction and for your tremendous advocacy. And I also want to thank you, Jesse, for your work as co-chair of the Puerto Rican Agenda of Chicago. I also want to acknowledge all of the event sponsors, the Puerto Rican Agenda of Chicago, the Puerto Rican Cultural Center of Chicago, and the network of the National Library of Medicine, and all of the organizations that made this wonderful virtual summit possible. I know that you are going to be joined over these 2 days from some tremendous leaders, like all of you on this call, but it's always certainly great to be joined by my friends and and my fellow elected officials who I know will be a part of this summit: Senator Dick Durbin, Congressman Chuy Garcia, and State Senator Cristina Pacione Zayas, all of whom are incredible advocates for their constituents. And on behalf of Governor Pritzker, I certainly want to extend a warm welcome and warm regards to the governor of Puerto Rico, Pedro Pierluisi, as well as the former mayor of San Juan, Carmen Yulín Cruz. To all of the leaders, advocates, students, and others who are joining us today, welcome. You all represent the wisdom that is in the room. And I thank you for your proactive approach to bringing awareness to and finding solutions for really the social and economic determinants that impact the health and well-being of the Hispanic and Latinx community. It is about lifting up your voices, challenging the status quo, and speaking out to lift up every community in Illinois, especially those that are often ignored or left behind. The voices of these communities deserve to be heard, and the needs of our communities deserve to be met. You know, I often think about the words of former US Ambassador to the United Nations, Samantha Power, who said that all advocacy is at its core an exercise in empathy. But a prerequisite to empathy is being able to listen and to hear and to understand what others are going through. Empathy is caring enough to recognize that when families are not healthy, then the community is not healthy. And when our community is not healthy, neither is our state. And empathy is not just a feeling. True empathy at its best is demonstrated by taking action. And what better example than empathy in action than the work of the Puerto Rican agenda that I first came in contact with a few years ago when you were coming together in the wake of Hurricane Maria to see the needs, come together, pool resources, and get to work in coordinating strategic relief and rebuilding efforts in Puerto Rico. And today's virtual summit is with that same mindset. The COVID-19 pandemic has turned our world upside down. And we not only have to address the social and health inequities during this pandemic that have hit Black and Latino communities disproportionately hard, but we have to advocate for policies through an equity lens to ensure that we are moving forward without leaving our communities behind. Why? Because resilience is not just a word that says, did we make it through? Resilience is not just about, well, did we survive? True resilience is about how do we come through this stronger and better? You understand that there are too many people in our communities who feel like they are drowning emotionally and mentally. And you recognize that we not only need the work that's on the ground, but we have to expose entire systems that are built to divest, marginalize, and disenfranchise so many. And then when we expose those systems, we have to change these systems for the better. Some of you know that I am a restorative justice practitioner. Restorative justice at its core understands that the solutions for our communities don't come from outside of our communities. The best solutions for our communities come from bringing people together who know and love our communities, the people who live in our communities, who are invested in our communities. And today's summit is exactly that. Bringing together those from Humboldt Park, from Puerto Rico, and other communities to really understand what a healthy and just community must look like in a post-COVID world. Now, one way to incorporate restorative justice in the fight for change in our administration is through the Justice, Equity, and Opportunity Initiative. Early on in our administration, Governor Pritzker signed an executive order establishing what we call the JEO, Justice, Equity, and Opportunity Initiative, and it's housed in my office, and we are ramping up efforts to really change the landscape of what justice really means. As I often say, you cannot have real justice without equity and opportunity. So what is justice? Well, sometimes we hear the word justice, and I can tell you that the last 24 hours have certainly been an example of that. You hear the word justice and you immediately think of policing, jails, and prisons, but that's part of the equation, but justice is not only that. Real justice and real health for our communities is about access to affordable housing and healthcare. It's about making sure that our communities have access to mental health resources, culturally competent mental health resources that include trauma-informed services. Justice is about quality education and pathways to economic opportunity, and justice is about access to healthy and nutritious food, clean water to drink, and clean air to breathe. So in many ways, justice, equity, and opportunity are right at the very center of having a healthy community. Because when we talk about health, it cannot solely be limited to our physical health and what's happening in our bodies. Through a restorative justice lens, the health of our communities depends on working collectively to repair the harm that has been done individuals one to another, to repair the harm that's been done by systems to entire communities, as well as the harm that is done by failed policies that have affected residents throughout our communities for generations. So, as was mentioned, last year, I convened a health equity working group of Black and Latinx health professionals that focused on ways to improve the quality of life of all Illinoisans in a just and equitable way in light of COVID-19, which again has disproportionately impacted our communities and is, in fact, as Jesse pointed out, rooted in systemic racism and colonialism. And we were so glad to have Aida as a part of this work. The working group prioritized recommendations relating to mental health, including supporting the expansion of telehealth services and collaborating with community partners to address individual and community mental health needs. This is especially important as we battle this pandemic, because in this country, we have lost more than 500,000 people who are now no longer here with us today because of this COVID-19 pandemic. And I'm sure many of you on this call, like me, have lost loved ones to this pandemic. And I want to pause for a moment to acknowledge that and to send my sincerest condolences. To be sure, we don't want to lose anyone in a health crisis, but we have to come to grips with the heart-wrenching fact that a disproportionate number of those deaths are Black and brown people. According to the CDC, more than 8 million people have now received a vaccine dose in the state of Illinois. 11% of those shots, however, have gone to Latinx or Hispanic people. But Hispanic and Latinx people make up 17% of this state's population. So these numbers aren't adding up, and that is costing far too many lives. Right now, we are working hard to make sure that the vaccine is available to every community. We have 1,000 sites, including mass vaccination hubs, partnerships with hospitals, QHCs, clinics, and community centers, as well as mobile units. And our Illinois Department of Public Health is ready to help. We have hundreds of staffers operating Illinois Department of Public Health vaccination sites and telephone hotlines, helping residents to make appointments. The call center has English and Spanish-speaking agents, and it's open from 6 a.m. until midnight, and that number is 833-621-1284. I hope someone will put it in the chat, 833-621-1284. I want to begin to close, because I know you have a busy agenda, but let me say this. There is a saying that hurt people hurt people. But I know all of you know, just like I do, that healed people heal people. And the work that you are doing through this summit and beyond this summit to heal people will ultimately heal entire communities. And when entire communities, as I said before, are healthy and resilient, that is a precursor to a healthy and resilient state, which leads to a healthier and more resilient world. I know that there has been an emotional toll from this pandemic, and I know that you care deeply for your communities and the health of your communities. But I want to say this: you cannot pour from an empty cup. And I want you all to remember, fellow justice warriors, that you have to practice self-care. You have to take stock of how you are feeling yourselves, even as you advocate for others, even as you fight for justice, even as you serve your communities. I know yesterday with the verdict of Derek Chauvin of being found guilty of murdering George Floyd, it hit me hard. In the midst of meetings and traveling and all I had to do yesterday, I had to pause for myself as tears were welling up and I felt the emotion of that moment. As I thought about how many others we also have to keep fighting for justice. So self-care is something that I have to practice, and I urge you to meditate. Find time to spend with your family and friends, even if it's virtually or socially distanced. Listen to music, take a walk, hold space for what brings you joy, because sometimes it's easy to forget in all of our business, in all of our busyness, in all of our advocacy, that your health and your well-being matters too. Thank you for having me today, and I look forward to working alongside of you to build healthier communities. Have a fantastic summit. Thank you.
What a great way of starting this summit, with your inspirational and words and your passion, and really really addressing the key issues that the whole summit is all about. Thank you so much for your leadership. Thank you so much for being available and talking to us today. We love you dearly. Come with the Puerto Rican community and the Latino community anywhere, not only the state of Illinois, but in everywhere, because you're really one of our mentor, one of the great leaders that we have. And I'm so happy and wish you the best of luck for all the things that you're doing in your office. God bless you. So now we're going to be briefly giving you some very brief rationale about why we came together as a to be able to put the summit and be able to share some of the information. That's not it. Some of the information that that we have. Sorry, I'm trying to get the slides ready. I apologize. So as we move forward, we're trying to look at in my desktop, my presentation, but this is, it's going to be critical, important to really take this opportunity to say that this activity was actually organized in the last, I would say, less than 2 months, 8 weeks or so. And it has been the hard work of the planning committee that came together of the Puerto Rican agenda, and the fact that we thought that this was the best way to be able to bring people together in a time where there is a sense of hope with the vaccination of COVID-19, or moving forward in a way that we could be able to start getting our agenda clear and to be able to reach out to the different community. The whole summit came about because we felt that there was too much attention given to the COVID-19 for all the right reasons. But the people, on the other hand, were experiencing, our community were experiencing excess death to non-COVID related condition during this period, because the healthcare system was not able to have the capacity to be able to take care of many people who ended up in the emergency room and wanted to be taken care of or be hospitalized, because they were not at that moment the priority in the population that we wanted to take care as a result of COVID. And for that reason, a lot of people that were living with cancer were not able to get cancer treatment on a timely basis. People who were diabetic type 2 were not getting the management and control. People with asthma, cardiovascular condition, and many other related conditions, they were not able to take care of that. So we thought that it was important not only to continue addressing the challenges that COVID-19 has brought to our attention, but we also wanted to continue trying to balance the attention, trying to get those individuals that also need different types of care to be able to get the bilingual, bicultural services that they deserve to manage their diverse condition. So as a result, it is critical that we take this opportunity, and I'm having someone here getting all this ready for me, so give me a minute here. And so I'm being distracted a little bit, but it will be there in a minute. Here it is. Where is it? But moving forward, I have multiple people looking at my, getting my screen, so that's why I'm getting distracted. So please bear with me. What I was going to say that the other reason why we wanted to focus on this summit, and here you have the objective, which many of you may already have, is to really provide a forum to discuss to provide. I'm getting distracted here for a number of reasons, so please bear with me. And as a Puerto Rican, I speak fast. Say in a short period of time, I go faster, so I apologize for the next panel on institutional and systemic racism that is presentation. But basically, you already know the objective. We want to bring to the attention the health problems, not only of Latino in general, but particularly Puerto Rican, and then to be able to lay the foundation for the development of a strategic plan that not only our organization, but many others in the area may be able to take from that experience and recommendation that we're going to be obtaining about that. Now, why is it that we focus in a Latino world? The population in 2013 said that we represent 17%. Right now, it's close to 19%. Between, and so the growth has been considerably. The largest group, obviously, is Mexican American, but 9% of the population happen to be Puerto Rican. And that's why Puerto Rican is one of the groups that we want to highlight today. We find that most of the states where the Latino population is at, more recently since 2000, is, state that traditionally we don't really associate with the Latino population. And here's more data about lately indicating that in 2015, 2019, the population is declining compared to the previous year, where there was an accelerating growth as a result of immigration, high birth and fertility. And we still expect that the population would reach 111 by 2060. Moving forward, the Spanish language, in 2012, 74% of Latino 5 years of age and older spoke Spanish at home. And most of the time when you look at the census, we don't have the census for the 2020. That's why I'm using some data that doesn't reflect that. But there were about 13 people, the US population in general, that spoke Spanish at home. And about 58% were Spanish speakers who spoke English well together with the Spanish. And this is important because we want to make sure that the message is loud and clear to our children and to other adult Latino. And as we raised in our grandchildren, like in my case, to retain the Spanish language and the culture. And furthermore, despite the many challenges that we have experienced as a result of oppression, institutional racism, and sexism, and the list goes on, Latino, is higher achiever. We have a culture that protects us and that include personalismo, expressing interest for the well-being of others, including our family and community, familiarismo, a strong sense of family responsibility, including compadres and extended family member. We highly value our children and protect them. We honor and respect others, particularly religious leader, the elderly, the mentor, the physician in our community are highly respected, and we has tremendous amount of influence. And then we also, respect and acknowledge the macho man. My husband was a macho man, and he was gentleman. He was protector of the family. He was a good provider. He was caring. So this concept that sometimes gets, viewed negatively, it depends on who do you talk to, because the macho men in our community are people who are responsible, are hardworking, are really trying their best to take care of their family. And then we have to acknowledge, a number of characteristics in our culture. Strong Latina women. We really have to take this opportunity to say that to acknowledge ourselves. We are good managers of the home. We work in multiple responsibility in the home or outside. And still we have time to take care of our kids, our elderly, and to even get involved in community organization, because many of the community organizations in the Latino are organizations that are actually developed by women. We have high work ethic. We have the ability to laugh and maintain hope during adversity, and then a very strong sense of collectivity. And the economic impact of Latino is one that is about second after white, with a high economic impact. Our purchasing power, our buying power is 1.5 trillion, to the degree that even, and then we also have an impact in the political aspect as well. For the first time, we had in 2016, 2 Latino running for president of the United States under the primary of the Republican Party. Maybe they were not the right Latinos, but they would at least, it's achievable that someday we're gonna have a Latino president. And right now, political party needs the Latino vote for any kind of election that they're running publicly. And so like Nielsen said in 2012, in politics or business, Hispanic Latino can make the difference between winning and losing the battle. And it's important to keep that in mind that we are highly achievable despite all the oppression and poverty and everything. We have tremendous amount of leaders that have distinguished themselves in so many fields and that we need to acknowledge, including Sonia Sotomayor, the first Latina appointed to the US Supreme Court. That we have Hispanic, they have won the Nobel Prize. And we have, you know, a number of others that have really made tremendous contribution in science and in many other fields. So don't let anyone tell you or to tell your children or grandchildren that they're not contributing to this country, because we are, and the data is very clear and the evidence is very clear about how we're doing that. And then in the area of health, we have a number of Latinas currently live, you know, except for Helen Rodriguez-Tree, a very good personal friend of mine, and other members who are panelists today. And we also have Antonia Novello. She was the first Latina appointed to U.S. Surgeon General. Then Richard Carmona, another Latino from Texas. Elena Rio, who's providing leadership with the National Hispanic Medical Association. Janira Cruz with the National Hispanic Council on Aging. Janel Norteño, Tobacco Prevention and Control. You have even some of the members who are panelists. Eliseo Perez Estable. You may not know that he's the first Cuban American who is right now the leader of the National Institute of Health Disparity and Health Disparity Institute. You have Hortensia Amaro. You have Ruth Zambrana, a panelist is going to talk next. You have Emily Ramirez working with her work on cancer. Olivia Polker Carter, very well known for her data. Greg Talavera, who is one of the multiple PI of the Hispanic Community Health Study. Marta Daviglo, who is the PI in Chicago Field Center of the Hispanic Community Study. And we're going to hear about more about that study through Larissa Avilés Santa, Dr. Larissa Avilés Santa, that's going to be coming next. And then you have a number of other people who have in the field of public health has really made tremendous amount of contribution, from Henry Monte, Carmen Nevaez, Diana Monta, who's going to be moderating the next panel, Marilyn Aguirre, a speaker in the next panel, her husband, Carlos Molina, George Flores, Jose Ramon Fernandez, who right now is the director of the board of the American Public Health Association, Jose Prieto, Fanny Fonseca. I mean, the list goes on. But it's important that as we think about them, think about the fact that we need to support our leaders. Those individuals are opening doors, dealing with tremendous amount of challenges in terms of academic institution or NIH or whatever they may be at. They are really trying to do their best to make sure that we are taking care of our Latino, that we are increasing the pool of public health Latino who are bilingual by culture. And sometimes the community doesn't know them well, and sometimes we don't give them the support. So if you see them or hear their presentation today, tell them thank you. Thank you, because they have been my support system since I was here. So it's very important that you really recognize and know who they are. And then we have powerful other civil rights leaders that we haven't even acknowledged, like Cesar Chavez. And we have the organization like Latinos Unidos, they used to be called the National Council of La Raza. And we have the Hispanic, Health Alliance. So there are a number of organizations that you should look in the website and find out who they are. And then going back to the Puerto Rican experience, with this I will be ending before we go into transition. But the Puerto Ricans, unfortunately, despite the fact that they are US citizen by birth, they are a second-class citizen. We don't get the same right either in Puerto Rico or here living in the United States. They tend to live in poverty with high, uh, in many community with high dependency in public assistance. They tend to have high unemployment. They tend to live in a world of despair when you think about many of the Latino barrio or Puerto Rican barrio. I was raised in one of those barrios in New York City between the years of 5 to the year 10 when my parents returned to Puerto Rico, although I was born in Puerto Rico. So I know because my parents were in public assistance. I know because we live in public housing, like Sonia Sotomayor. But you have to realize that despite all those challenges, we could overcome and still be able to reach our potential to the maximum. But the data on Puerto Rican that is emerging indicate that they experience high obesity, high type 2 diabetes in Puerto Rico and here, chronic pulmonary diseases like asthma, a higher infant mortality for all kinds of reasons, higher depression, and serious psychological distress. Dementia developed early among Puerto Ricans, 68 years of age compared to other groups. High alcohol and substance abuse because many of them, including the use of opium, are still struggling with all the tremendous amount of challenges that they experience in our society. And there's high cancer rate, including some of the study that we've been doing in Chicago that is closely associated with where the community, the barrios, and the African-American neighborhood are located. Poor sleeping pattern. We have a workshop on sleeping. We do tend to have more so than other groups, sleep apnea and sleep disorder. So that's why that workshop is going to be addressing some of that. And poor access to health and medical care due to linguistic, cultural, and linguistic financial barrier, the lack of health insurance being a key factor. And despite all that, we still have barriers to access to higher education. And the underrepresentation of Latino is very clear in every field, including health and medicine. So there's a lot of work that needs to be done. And with that, I'm going to go into transition by letting you know that our next speaker, I mentioned her as one of the key leaders, that she's really have provided leadership in so many different areas, that I have had a pleasure meeting her throughout the years, that she has been one of the mentors together with the other women that I mentioned. They have been mentoring each other. It's an arm that you have to cry. I usually use Ruth Zambrana arm whenever I'm having all this many, when academia drive me crazy, so to speak, for lack of a better word. So in her own right, I really want to thank her and thank the members of the next panelists for taking the challenge to really be with us and share and discuss elements that has to do with institutional and systemic racism and their impact on Latino and Puerto Rican health. So thank you so much.